Hello everyone, it's Uswah. So after my last video, I had a lot of recommendations about making a video regarding how to make the most of your clinical years. So that's what this video is about. So in terms of making the most of your clinical years, we all know that theory is a big thing and it's very thorough, especially in Bulgarian universities. But one thing that we all need to polish up upon as medics is our practical skills and our history taking skills. So that's what I really want to focus on in this video and how we can kind of implement this throughout our degree. So there are five main examinations that we should kind of know inside out by the time we finished our degree. These are your respiratory examinations, your cardiovascular, your abdominal, your musculoskeletal, and your neuro examination. So with examinations comes the history taking, which is the first step. With history taking, because our degree is in Bulgaria, naturally the people there a lot of them won't speak English. And to make the patient more comfortable and to show that we respect them, it's important for us to know Bulgarian. It is, of course, a very difficult language, so if you're not fluent in it, as myself, it's very useful to have like a little phrase book with the most common sort of questions you would ask your patients. For example, what was the reason for you to come to the hospital? Do you have any pain here? So if you can just kind of have this little book and just learn these phrases throughout your degree, hopefully by the time you go into sixth year, you will be fluent in it. And, even if you're starting on it now, it's better to start it now than never. Physical examinations, what I recommend is that you study how you carry out the examination, of course, and then you watch some YouTube videos about it. I recommend Geeky Medics. Their OSCE videos are excellent for physical examinations. After you've watched the video, the best thing is to practice on your colleagues, so other students. Try to make a small group and do a patient case scenario, a patient and doctor scenario, and just sort of practice upon each other and then switch around. And after that, once you're comfortable with that, it's really important to practice on your patients. Of course, you need to make sure that your patient has given you consent and that the patient is always dignified and comfortable. And it's also important to make sure that you've told your doctor that you are about to practice on a patient. So if you're in a class and obviously your doctor is there, that's not a problem. To practice on patients outside of your lessons, which I do recommend. It's just important to make sure that you ask the supervising doctor if you're allowed to do so and just inform them, and hopefully they can recommend you some interesting cases as well. And after that, you can just go approach your patient and of course give them all the information regarding what you're about to do, and make sure that you introduce yourself and then make sure that you get the consent of the patient. And do make sure that you ensure that your patient is not in any pain and that you're not eliciting any pain. Keep an eye on their facial expressions as well. And after that, you can just carry out your examination, and once you're done with it, thank your patient and make sure to wash your hands. So one more thing I want to add is an important thing that I have been using during my degree since third year is the Oxford Clinical Handbook of Medicine. So this book is a very small book that you can carry. I carried it in my lab coat pocket. It was very small and it was really useful. It just basically, summarizes a lot of the diseases, probably all the diseases that are very important for you to know as a UK medic. And it just sort of has the disease and the investigations you would carry out and the management of the disease. So what's important is that when you go into the ward and you see a specific disease, use your Oxford Handbook, refer to your book, and it's very important that you familiarise yourself with the sort of investigations and the management you would carry out on that patient. Of course, this just varies a little bit between Bulgaria and the UK, so it is important that if you plan to work in the UK, that you just read up and refer to the book and you just constantly familiarise yourself with those investigations and management. Of course, if you can find any memorable patients, that's only going to make things easier for you. So this would just be any interesting cases, because obviously this is going to be something new to you and it's just going to help you remember the disease much better if you have some unique cases of that disease. So in terms of making the most of your clinical years, my main summary of it is just to make sure that you perfect your history taking and your examinations. Ensure that your history taking has a good structure and that is used throughout all your history examinations. And then also to make sure that your physical examination is as thorough as possible, and just any chance you get, just keep repeating the examinations. They'll never be perfect, but we just need to keep repeating and practicing them. And as I said, to make sure that if you have not got the Oxford Handbook already, please do have it. If you cannot buy the book, it's even easier to have a PDF on your phone, and just have the book with you, refer to the book, and familiarize yourself with those investigations and management. In terms of other skills, which I know a lot of students are concerned about, which include, for example, taking bloods, doing cannulations, doing catheters, those are really your competencies which we carry out as foundation year doctors. And of course they are important and you do need to know them. I've spoken to a lot of junior doctors and the feedback I've received from them is that it's not something that is something for us to worry about. It's something we can learn within a few attempts, within a couple of months, and we're not expected to know it properly. We can afford to make mistakes in those certain skills. On the other hand, our history taking and our physical examinations are something which we cannot afford to make mistakes on. So I really do recommend that while you're in medical school, please do take your time out to take these skills very seriously. And because if you miss something, that can affect the whole prognosis of your patient. So those are my tips to make the most of your clinical years at medical school. I really hope they were useful. And if you have any more recommendations of videos, any suggestions, or if you just would like to message me privately for advice, please feel free to. Thank you very much.